This session is within the Human and Social Services track of Iowa Ideas. And a reminder before we get started, the session does have closed captioned access, and it is also being recorded, as you just heard that recording started voice. Throughout the session, our audience members, you're all invited to submit questions for our panelists. That goes through Whova, and then I'll see those. And speaking of our panelists, let's get started. Let's introduce them. So we have Adrian Corbacus is appearing first on my screen. And Adrian is the Chief Operating Officer of Community Crisis Services. And then we have Joe Smero. He's the CEO of Solution Point Plus, which provides crisis intervention training to law enforcement officers. We have Emily Blom. Emily is the Executive Director of Foundation 2 Crisis Services, and then Peggy Huppert. And Peggy is the Executive Director of NAMI Iowa, which is the National Alliance on Mental Illness. So that's kind of a quick rundown of our group, but I'll let each of them introduce themselves a bit more and tell us about their connection to the 988 rollout here in Iowa. Adrian, do you want to start us off?
Yeah, absolutely. Thank you, Emily. My name is Adrian Corbacus. I am the Chief Operating Officer at Community Crisis Services. I started with Community at kind of an exciting time in May of this year. So I've been here for about 6 months now. And one of my primary responsibilities when I started was helping to implement 988. At Community, we answer the bulk of the texts and chats here in Iowa. We also back up Foundation 2 on the phones. And we also have a national 988 contract. So we do backup chat text for the entire country as well. So we had both of those contracts coming online at the same time.
Oh, yeah. Awesome. And then Joe, do you want to go next?
Yeah, thank you. I'm Joe Smaro. As mentioned, I'm the CEO of Solution Point Plus, and we've been providing training throughout the state of Iowa since 2017, starting in Johnson County, Iowa City area. And we have multiple programs that we're involved in throughout Iowa, not just crisis intervention training for law enforcement, but also providing de-escalation training for mobile crisis workers, and also helping set up and establish some version of co-responder models or a co-responder model, depending on what it is that's needed in that area. And so again, just super grateful to be here on this panel and really appreciative of the work that we've had throughout Iowa, in great part because of the leadership from the MHDS regions and the CEOs. And so just very grateful to be here and help however I can discuss the 988 rollout.
Awesome. All right, Emily.
Sure. Good morning. Emily Bloom, CEO at Foundation 2 Crisis Services. We are headquartered in Cedar Rapids. We have a couple connections to 988. We're one of the 2 centers, along with Community Crisis Services and Food Bank in Iowa City. We do primarily the phone services and provide support for chat and text. And then we also have mobile crisis outreach services in 11 counties in Iowa. We've been doing that for almost 20 years. And then we also have, as Joe was talking about co-responder models, we have 8 departments in Eastern Iowa where we have law enforcement liaisons that are embedded in those areas. And so pretty integrated organization in crisis services and suicide care in Iowa.
Awesome. Peggy?
Well, thanks for having me, and I'm really glad we're having this panel discussion about something so important. NAMI has been advocating for a 3-digit crisis number for years, unsuccessfully until the pandemic, which is really what prompted a pretty quick approval at the federal level. It was signed into law in July of 2020. And then actually was implemented this past July, which, by federal standards is lightning quick. So we've been involved nationally in convening a group of stakeholders about the implementation of 988. We continue to hold monthly meetings with hundreds of people from across the country, sharing ideas on leading up to, of course, the implementation, how to do it most effectively. And we're continuing to meet to compare notes as to how it's working in our states and what advocates can do to make it better, to improve it. And that's really been my role and function. NAMI is an education advocacy organization. And so our CEO said a year and a half ago that he saw 988 as a once in a generation opportunity to dramatically improve crisis response in this country for people who are having a mental health crisis or behavioral health crisis. And I agree with that assessment. And so I served on the planning committee for the state. And we have done everything we can to promote it, to make people aware of it, and to make sure that it's working the way it should.
Awesome. Thank you so much. Real quick, before we dive into some questions and some discussion, I just want to give a quick overview. I realized I should have mentioned kind of what 988 is. Obviously, 988 is the 3-digit crisis number. Previously, there was the National Suicide Helpline, and that was a full 10-digit number, but now it's just 988, similar to 911, that easy to remember, quick number, and that rolled out earlier this year. So it's been a few months now that they've been working with that new number and probably a higher call volume, I imagine. So let's start with just what has gone well so far this year with the rollout of 988, especially Adrian and Emily, I think, to this, and then what could be going better?
Sure, I'm happy to jump in. So a couple things that we think have gone well. One of those is that the two organizations that are leading 988 and answering those calls, chats, and texts have over 100 years of experience between the two of them. And we've been working together for decades on crisis response in the state. So we have a long history of working together and partnering. And so I think that was really instrumental in helping Iowa kind of roll this out rapidly. I also think that both centers did a really great job trying to onboard staff rapidly. We didn't really know what to expect, and there was a lot of numbers flying around regarding volume and length of call and severity and acuity of callers and contacts. And so really making sure that we were as prepared as we could be on the 16th of July. And that just took a lot of effort relating to onboarding, training, trying to build capacity to meet the demand.
Yeah, definitely. Adrian, do you have any thoughts?
Yeah, absolutely. I want to, echo what Emily said, and also talk a little bit about the quality of services that our centers are providing as well. It's not just enough to have somebody there to answer the phone or answer the chat or answer the text, but you have to make sure that those staff are capable of providing high quality services to the individuals that are on the other line. And so I think as you scale programs, one of the things that you have to keep a close eye on is also the quality of the services that you're providing. Here at Community, we've had a very highly rated chat and text program for several years. And so as we scaled that was one of the concerns that we had, is with bringing on all of these new staff really, really quickly, trying to get people through training, trying to get people on the lines. Are we going to be able to maintain that quality that we've had? And one of the things that I've been really excited to see is that our quality rating actually increased with the 988 rollout. And so that was really exciting to see that our training is working, our structure is working, and that we're still able to provide those high quality services just at a much larger scale.
Yeah, definitely. What is that quality rating based on?
So the quality rating is for chat and text programs. It's through the Lifeline. So they do a quality assurance process internally, and then they give centers different quality ratings based on internal metrics that they have.
Awesome. So what have you guys been doing to kind of keep up that quality, to make sure that there is, that the person answering the phone is able to address the specific needs of each caller?
Yeah, well, the training components of this, I think, are critical. So our team gets approximately 70 to 80 hours of training before they take any calls, chats, or texts. I think part of the difficulty is hiring for people who are able to remain calm and rational and empathetic and non-judgmental through really high stress situations. We have concerns about turnover and capacity because the work is very, very difficult. And, these are not people that are out there making, 6 figures doing crisis response work. And so helping our teams have training and feel really confident to do the work, not knowing that when they pick up the phone or respond to a chat or text, like they really don't know what's on the other end of that. And so it could be someone who's sitting there with a loaded weapon beside them, who's really contemplating suicide. It also could be someone, who it's a situation that, for some of us may seem like not a very high stress situation, but for that person is. So, the idea that there's no problem too big, there's no problem too small. Our crisis counselors are really capable of answering and doing the things and being what the person on the other end of the contact really needs them to be right then. I think there's also some challenges with people don't always know what they need in that moment. And so how do our teams help navigate, kind of process and navigate what those next steps might be, just because they just legitimately don't always know what they need. And so we need to help them with that. And there's some training components around building rapport and engagement.
Yeah, definitely. Let's talk a little bit about that. What happens when somebody calls 988 and they may need more than just a phone call? Where are they directed to? Is there, what's the crisis response look like for those situations?
Adrienne, I'm happy to jump in, but you can.
I think it really depends. The landscape of Iowa, when we think about the crisis continuum, it looks different region by region. And so the services that may be available to individuals may look different depending on where they're geographically located in the state. Most areas of the state have some sort of mobile crisis provider that would be available for them. There's also access centers kind of dispersed throughout the state that people can be directed to for those in-person responses. What I will say is that the vast majority of callers are able to be stabilized either over the phone, chat, text, or whatever medium they responded in, and less than 2% of calls require any kind of law enforcement response or emergency response. And so I will say our teams do a really good job being able to engage and de-escalate folks just over the phone, chat, text. And so a lot of times folks don't need that higher level of support. And if they do, we try to connect them with the least restrictive service that's going to meet their needs the best.
Yeah. I know for the most part, law enforcement isn't usually involved with 988 calls, right? So what's kind of the difference between a crisis response when it's law enforcement, if someone calls 911 and police are sent out, versus what they'll get when they get a crisis response from one of these crisis response teams? And this kind of open to everyone. I know, Joe, you work specifically with the law enforcement side of that and with some of the crisis response. And
Emily, if I could, I'll just say the reason that NAMI feels that this is so important is because when people call 988, they're getting a trained counselor who knows how to deal with a behavioral health crisis and can help them immediately. When they call 911, they're calling, certainly 911 dispatchers are trained, but they're trained to dispatch. They're trained to dispatch emergency responders. They're not trained crisis counselors. So by having a 3-digit number where we have that help available immediately, via phone or via text, we're able to help a lot more people that way immediately, rather than having to dispatch in-person response. So that's a critical difference. And we know that 80 to 90% of outreach can be handled effectively by the very capable staff people at a Foundation 2 and community.
awesome. Anyone else
And I
have any?
think,
thoughts?
yeah, I think that's the big differentiator right there, though, right? Is that community education component, because we're still, I mean, this has only been out for a few months, as we've mentioned. And like, do people know themselves when I should call 988 versus 911? And sometimes the answer is no. And so it is on those trained staff to then be able to navigate, where does this actually belong? I appreciate the numbers and the data, and I always want to go like one step further. So if less than 2% require an in-person visit, then I wonder how many numbers there are. I wonder, because when I look at this, I look at it from a grand scale, right? Nationally, and then you look at it by state, and then you look at it also in each community. And we know that we still have a long way to go. Just as any system, right? 988 is not funded the way it's going to need to be. It's not staffed the way it's going to need to be. And so the burden is still going to fall back on any 24/7 operation, which is typically going to be law enforcement. And while that's a sad reality, it's still a reality. And so I think it's very important that we understand that it's just as important. And again, I think this is kind of a long play. I mean, I see it as like a 5-year transition where things could be pretty drastically different 5 years from now. But for the next several years, it's going to take a long time to actually get, because I know 100% of 988 calls aren't being answered anywhere. There's still a drop-off rate. There's still people that aren't getting the services that they need. And so again, it really is, we have to look at this from a holistic approach where each sector of this, each entity, that each intercept point, if you will, whether it's the first responder dispatch, the 988 mobile, or the counselors, or whoever is getting that, even the paramedics or EMS. And like, there's so many complex layers that go to this to ensure people are getting the quality care they deserve. And I think intention matters, right? If the goal, and I'm not saying this is, but if the goal is going in, my focus is to try to diffuse or de-escalate this over the phone, that's going to happen more often than not, right? Because that's the target. If the target is, I really want to see this individual and ensure their safety and look at their environment to make sure that they're safe, then obviously that needs to be the focus as well. And so again, it's very complex, and but I love that each component. And to your very first question, Emily, about like the success, I just love that it's working, right? That 988 actually exists. It's a number that people can call and something happens. So like, at least the first step has taken place, which is super important. As Peggy mentioned, I mean, it was super fast to roll out. My fear is, if you look back at history with deinstitutionalization and everything else, there's been great ideas throughout history of how we can do things better. But if staffing and money don't follow suit, then the programs aren't sustainable.
Yeah, definitely. We talked a little bit, Adrian and Emily kind of mentioned that you were hiring a bunch of staff really quickly for this. So let's go into that a little bit more, staffing and funding, like Joe was saying. I know, what does your staffing look like? And then where is the funding coming from right now for 988? Those are kind of two separate questions, but I guess we'll start with staffing. Is there still troubles with that, or are you kind of keeping up?
Yeah, go ahead, Emily.
No, you go ahead, Adrian. It's fine.
Okay, no worries. So staffing has always been a bit of a challenge. You know, like Emily and I both talked about earlier, this is pretty specialized work. And even within the mental health field, crisis services are somewhat niche. And so it can be a little bit challenging to find staff that want to do this work and that are also capable of doing this work. I think we've been very fortunate. One of the benefits of the pandemic, I caution to say, was that most of our training was converted to virtual mediums so that staff are able to complete training from, their own homes and across the state. So we've been able to draw on a larger pool of staff than we have been historically. So we have staff scattered all over the state of Iowa who are answering 988. So I think that that's been really wonderful, is that we've been able to kind of expand our pool for where we can recruit staff. But I think it's going to continue to be a challenge. These positions, people burn out, we have turnover, we have people that, end up realizing once they get into the position that it's not what they thought that it would be, or that maybe it's detrimental to their own mental health. And so, they end up leaving for various reasons. And so then we have to rehire and retrain. And so I think that that's going to be an ongoing issue that we're going to see, as our numbers continue to increase and as these contacts continue to grow. I think that that's just kind of part of the work that we do, is having to recruit, hire, train pretty consistently.
Yeah, and I completely agree with everything Adrienne said. I would mention that the supervision of a remote workforce doing this type of work is not easy. So when we have counselors all over the state of Iowa sitting in their homes, taking calls from people with varying situations and crisis, including people who their suicide risk is very high, the way that you supervise someone like that remotely can be difficult. Does your team member have what they need? Do they have the tools they need? Are they having a bad day? How do you create a workforce that can acknowledge, show up with some vulnerability and say, like, hey, today I'm not my best, like I can't do this work today. How do we figure that out? And so I just think that there's a lot of, from a supervision perspective, there has to be a lot of empathy in how we supervise these teams of people, in addition to making sure that they are well trained to manage the types of situations that people are calling about.
Yeah, of course. Awesome, thank you. And then kind of to the other question, where is I know Peggy and we talked about this a little bit before this session, but where is the funding coming from currently? And I think it's sort of a temporary fix right now. So what things are we looking at to hopefully be able to provide more funding in the future?
Great question, Emily. So the funding for the first 2 years for both centers is a combination of federal funding, including some COVID supplement funding, some ARPA funding, some mental health block grant funding, and then SAMHSA through a little bit of money. I say a little bit, but through some money behind states. And that money was actually based on per capita. So when you look at a state like California, the amount of money they got versus a state like Iowa. And so the revenue for that cooperative agreement was kind of split out that way. I know the state of Iowa continues to explore funding options past kind of this one-time 2-year funding to get 988 sort of up and running. I know that there are other states, some have been successful, some have not, that have done a like a cell phone fee similar to the 911 fee, where it's, something to the effect of, 40 cents per line per month. And that goes into a very designated pool of money to support 998 and crisis services. But I don't have the numbers in front of me, but I think maybe only 6 states have been successful with making that work. So I know that it's on the forefront of the Department of Health and Human Services. I know they're thinking about it, but I'm not sure we have a plan in place yet. We have about just under 2 years to figure that out.
Okay. Peggy, do you have any thoughts on that? Oh, are you stuck on mute? Oh no. I don't know if I can fix that. We will let our tech person work.
Okay.
Oh, there we go.
I just got a message. All right. I didn't realize that if I muted myself, I could not unmute myself. So lesson learned. Yeah, so funding is certainly an issue that we are concerned about. That's something that we're addressing in our national group and talking about. We started out with a big push to get the phone surcharge adopted in each state. And as Emily said, I think it actually is 7 states ended up doing that. There's another state, Missouri, that passed permanent state funding for 988. But most states, like Iowa, have not done that. And The predominant reason for that is, well, there's two. One is they wanted to wait and see what the volume was, what the need was, and really what the level of funding should reasonably be, because there were a lot of questions about that. The second one is that, most states are still awash in federal COVID-related funding. And it's hard to argue to put in place a new, as the policymakers see it, a new tax, even though it's not really a tax, it's a surcharge on phone bills, a little bit that everybody pays to fund the system. But it's hard to argue the need for that when a lot of states are, like Iowa has, $1 billion+ in surplus money. So yes, as Emily said, there's it's a 2-year funding plan. We're not convinced that that's going to be enough money. We're not convinced that it's going to actually fund all the different aspects of crisis response, because there's more to it than just answering the phone and responding to texts. As Joe alluded to, there are people who are going to need to respond to in person, and then there are people who are going to have a place to go. And so we have to make sure that those pieces are in place and are funded as well, so that no matter where you live in the state of Iowa, you're going to get the appropriate response from trained people, and you're going to have a place to go if you need to go somewhere. So it remains to be seen if the funding is adequate. And that's what we as advocates are going to be watching for, because we obviously it's going to be an issue in less than 2 years when this temporary federal money is gone. But we're going to need to be talking about it far in advance of that.
Yeah, definitely. Money runs out a lot quicker than you think.
Well, what's interesting too, based on what Peggy just said, and I was reading an article on this, that they're already anticipating for FY23 to have over 7.5 million calls to 988, which they've said is going to cost about $560 million to run, and only 1/5 of that is going to be federally funded. And so then it's like, to your point, where does the rest of the money come from then? And it really is sadly going to fall back on strategic partnerships and creativity of each state to find ways to make up for that difference. And that's just for next year. And I do believe that as this 988 continues to roll out and get staffed up and improved, you're going to have that contagion effect where you're going to see quite a drastic increase of people utilizing it. And again, that's that like 5-year play where I would imagine we're going to have 2 and 3 and 4x the numbers we're seeing this year and next year as this rolls out, which is why we need to do it responsibly and I think have difficult conversations, because again, what Peggy said is right, is we can talk all day over the phone, but for those people that need in-person services, where are they going to go? It's been the divert to where question for years. And it's not like with 988 rolled out a bunch of new brick and mortar inpatient mental health facilities. So it's really going to, I believe, tax each system that's already in place and create a greater need for increasing services throughout the regions.
Yeah, definitely. So talking about kind of those services beyond just the answering phone calls, the crisis response, the physical places to go if someone needs it, how does that differ from kind of area to area in Iowa? I know in some of the rural areas, there may not be as many resources, and kind of how's that being addressed?
Well, one of the challenges we see is the lack of consistency around mobile crisis outreach services. So we know that best practice is that mobile crisis services are available 24 hours a day, 7 days a week, respond to anyone of any age, anywhere in the community, and can respond without police. And the difficulty is that that's an expensive service when it's structured that way. Paying teams to be on call. I mean, all crisis services really function from a from a firehouse model, similar to a fire department or police department, where we pay someone to be available. And even if no one were to call, we still have to pay someone to sit there and be ready to answer the phone. So that's one piece that I think is important. That consistency piece takes time. Iowa does not currently have the infrastructure set up to be able to have the exact same service in every single community for every single Iowan. So right now it's still, siloed to some extent, but there is such good conversation happening about how do we make sure that there is that consistency, that every community does have options for in-person supports, and that every Iowan could call 988 down the road and get an in-person support in less than 60 seconds, regardless of their age, regardless of where they are, and without law enforcement if that's what they want. There's a lot of national research that shows that our Black and Brown families, even if they're having a mental health crisis, they're concerned about calling 988 or a crisis line because they don't necessarily want law enforcement to show up. And we know that there is, and Joe can jump on this, I'm sure, but we know that there's some power differential when someone shows up to respond to a mental health crisis, wearing a uniform, having a gun. And what we want is that whoever that person is, whatever their age is, they're going to get the safest, least restrictive level of care for what's going on with them right then. And that takes time to build that system out. It takes money to build that system out. It takes a workforce to do that. And we're making great strides in Iowa, but we still have a lot of work to do. I mean, this is the current state of 988 is kind of this kind of mushed together. We're making it work. And we're actually, the data points say like I was really successful right now with 988, but it's going to take, the future state of 988 is what I'm excited about. And I agree with Joe completely. I think we're looking at 3 to 5 years for that to be what it really should be.
Yeah, and I just want to jump in here and say that Iowa, in my opinion, and I base this on what I hear on our national calls and hear from my colleagues around the country. Iowa is ahead of the curve on this. There have been states where it has been a disastrous rollout of 988, where calls are not being answered, where they just were overwhelmed right from the get-go because they were not adequately prepared. And here in Iowa, we had the advantage of having Foundation 2 and Community, which had been doing Your Life Iowa, which is still in place. But 24/7 crisis response for behavioral health and other things too. But they had that experience. They had that under their belts. And they were established and also national providers. And not all states had that. So I always felt pretty good about our ability to get started well. Because of these two providers, and that has proven to be the case, which we're very fortunate for. Ohio, for example, had a complete meltdown at the beginning. So we can be thankful and grateful that we had the foresight to have Your Life Iowa and have that in place. But we still have miles to go for sure.
Yeah, definitely.
Hey, Peggy, Texas was one of those states that struggled, and this is
Oh,
from
really?
them. Yeah. So again, it's been a few months, but currently we're only answering 60% of 988 calls. And from the mouth of the head of Department of Human Services, she said their goal is within 2 years to get to 90%. And I was like, how is that the goal? Yeah. So just to your point, there's places that are struggling, and for a myriad of reasons. Again, staffing being the main one is based on population. It's very difficult to staff these 24/7 centers, which is again why law enforcement continues to be that de facto. And tying back to your question, Emily, this is the frustration that a lot of first responders in rural Iowa have is they're like, look, we kind of get a bad rap because, we're looked down upon as if we're a part of the problem. But if we're dealing with someone in a mental health crisis and it's got a high enough acuity, where am I taking them? If my option is it continues to only be a jail or an emergency room, those are not great options. And we know this, right? And so again, I think it's important that we don't just, and I'm not saying anyone is, but we don't just take a blanket look as first responders are part of the problem, when is like, look, we're handcuffed ourselves. We don't have options to take the people in the members in our community into any alternative services for care. We're really limited. If I find out someone's acutely suicidal, well, you either get to go to a jail and hold up until we can find a bed somewhere in Iowa, or we can put you in an ER somewhere and hope that maybe it resolves itself, come up with a safety plan. It's unfortunate. And so again, that's throughout mid-America, right? In these rural areas, there's these challenges of our more populated areas throughout Iowa, in the few communities that we have that have great resources in place. That's beautiful. But anytime you do these state convenings where officers from around the state come together, there's always that like angst of like, well, yeah, of course that's great for you guys because you have access to X, Y, and Z, but what about us? And there's that like left out feeling in a lot of these rural parts. And so again, I know each region individually is doing their best with what they have to try and create some type of alternative, opportunities for care. But everything's expensive, right? Like no one goes into mental health to get rich. And so it's super unfortunate. But again, we keep fighting the good fight, and hopefully conversations will help spark something.
Well, I'll just add to that, Joe. I agree with you. And I'll add that even in the metro areas, we do have more resources, but even though there are ostensibly almost 1,000 psychiatric acute care beds available across the state, in reality, there aren't, because a lot of them are not staffed.
Yeah.
And they are not staffed to handle any kind of complex case at all. So there are only 7 or 8 facilities in the entire state of Iowa that can truly handle any kind of complex case. Right. And those facilities are constantly full, constantly. So that's why you can end up waiting for 3 days in an ER in the Des Moines area, just as well as anywhere else in the state.
Right.
Because that exists. And then going even further down, some of those hospital beds are being taken up by people who could leave, but they have no place to go. So we need that continuum of care in place so that people can keep moving through the different levels of care as they need to, and that there are places available, slots available for not just beds, but community-based intensive programs that we know work, but there just aren't enough slots. So it's all part of it, right? If you get clogged up in one part of the system, it clogs up everything.
Yep.
Yeah, definitely. I'd like to take a second to remind our audience that you can submit any questions that you have through Whova. I think I mentioned that at the beginning, but we've had a lot more people join since then. So any questions you have for our panelists, we only have about 15 minutes left. So anything you want to know, anything you want to ask, just let us know, and I'll be seeing those questions and I can bring them in. Going back a little bit, we mentioned, obviously with all these different services we have and the pieces that are missing from that, that is a very small percentage of the people that are calling 988 that do end up needing those services. Because we said most of these calls are resolved over the phone. And I'd be interested to hear a little bit more about that, kind of what is the process of resolving calls? And obviously it's going to change from person to person, but what's kind of the instruction that these people answering the phones have for how to kind of walk me through what'll happen if I call 988 and how that gets resolved, I guess.
Sure, I can.
Emily.
So, the trained crisis counselors that answer the phone, really the majority of their work is to build rapport, try and obtain as much information as they can through creative and kind of consultative conversation. And so when someone calls, there's kind of a what's going on with you today, what prompted you to call. We know that mental health is complex. We know that it's not just one thing, but there's typically some type of precipitating issue that said like, okay, I'm going to call now. There is some exploration around coping skills. There's trying to de-escalate if someone is in a kind of a heightened state of crisis. There's always a level of suicide screening and assessment to make sure that we're keeping people or helping keep people as safe as possible. And then really helping guide them to some type of plan or, what we typically refer to as a disposition that makes sense for them in that moment. And so sometimes that is being able to send mobile crisis services in their area. Sometimes it is active rescue, and we do need to send some level of physical response because there's a life-threatening challenges present. Sometimes it's telling them where an access center is in their service area that they can physically go to. Reminding them of supports that they have in their community. Often these people already, they may be connected to a therapist, so it may be a reconnection to that therapist, or they may have been seeing a psychiatrist and taking medications, but weren't med compliant. And so trying to talk through, the importance of what has worked for you in the past. What can we help create that will work for you right now? And then always reminding them that they can reach out again. I am a person that philosophically does not believe in this concept of the revolving door of crisis services, and that is unsuccessful. I think every single time someone calls a crisis line or chats or texts, and that addresses that issue right then and keeps them out of a hospital, keeps them out of a jail, that is a successful intervention. And over time, we know that by making these community connections, by helping do suicide screening, by helping them realize the skills that they have and know, and helping them use those, like that is successful intervention. Crisis isn't planned. If it was, we would want crisis to happen on Tuesdays between 9 a.m. and 11 a.m. And that's not how that works. And right now, we talked a little bit about data, but right now, Iowa, we're answering 93% of calls in Iowa, and chats and texts, Community Crisis Services and Food Bank is doing phenomenal. 100% of chats and 99% of texts are being answered in the state of Iowa that are coming from Iowans. And both of, we Iowans know what services are available in Iowa. We want those calls, chats, and texts answered here. So that's part of that reason why building up workforce is really important. If these calls go to a backup center in LA or Baltimore, they can't dispatch mobile crisis. They don't necessarily know how rapidly services are changing in Iowa. We should be answering those calls. And I think both centers are really proud of our teams who are answering. I mean, we're one of 20 states that has over a 90% answer rate.
That's awesome. So any of those calls that don't get answered here, they do get answered somewhere every time someone calls, correct? They get just bounced to someone else. Okay.
Yes.
Gotcha. Adrienne, do you have anything to add about the process, kind of when those calls happen?
Yeah, everything that Emily said is absolutely accurate, and kind of the approach that we take. Just to add to it a little bit, I think one of the misconceptions sometimes that folks have around what happens when people call 988 is that we're going to make a lot of referrals, or we're going to work on, solving people's issues or problems. And really, that's not the focus of the counselor's interventions. Really, we're trying to listen. We're trying to hear what's going on with them. We're creating a safe space for them to share their story and their experience with a counselor in a very non-judgmental way. If there are referrals that would benefit an individual, we absolutely will make those. But the primary focus is really just listening, validating, sharing in that experience with that individual for a period of time, and then starting to find ways to focus on safety and look for ways to help that person move towards creating some sort of a safety plan. Like Emily said, we do universal suicide risk, screening and then assessment if necessary, putting those safety plans together. But really, I think the most important skills that we work on with our counselors is, building that rapport with individuals really quickly, but then really those kind of fundamental counseling skills of being able to listen non-judgmentally, validate people's experiences, and then help them identify what it is they want to work on or what it is that's important to them to, move towards.
Yeah, I think that's so important, making sure that kind of people just have someone to talk to. Obviously, a lot of the times you can feel super alone, and that's what the point of this line is, I guess.
Yeah. Well, and you think about it. You think about the times that I've been really upset and I've been, wanting to talk with a friend or wanting to talk with a loved one. I'm not usually going to them looking for, advice or solutions or telling me how to fix my problem, right? I'm looking for somebody that can listen to me and that can understand what I'm experiencing. And, a lot of times that's what individuals need. They don't need somebody to swoop in and fix the problem or things like that. They just need somebody that's going to listen and understand what they're experiencing and maybe even share in that burden for a period of time.
Yeah, Emily, I would also add that both chat and text, as well as phone, we get a lot of what we refer to as third-party callers, people who have concerns about someone in their life and don't know what to do. They don't know what to say. They don't know what next steps are. And I was on a panel probably 6 weeks ago, and I mentioned that, and people were like, I had no idea. And so, one of the things that is important is, if you are concerned about a parent, a partner, a child, you're concerned about a friend, an employee, a student in a class, you can call 988 and say, I don't know what to do for this person. Here's what I'm seeing. Should I be concerned? What could I say to them? How do I have that conversation? And our teams are prepared and really supportive for those callers to help them engage with the people they care about. And I think that's a lot of what suicide prevention looks like. Like, it's all of our responsibility to, when we see someone who we think is suffering, that we're concerned about, that we can have that difficult conversation with them. But for people like Adrian and I and Joe and Peggy, like, we live and breathe that stuff every day. But for people who don't do that, having those conversations can be difficult. And so 988 is an excellent resource to be able to say, like, how do I have this difficult conversation? When should I be concerned? And get some expertise to help kind of guide that work that people across the entire state are having with the people they care about.
Yeah, that's a really, really good point, Emily, and such a valuable resource. And I appreciate that outreach to 988 or to Your Life Iowa also, they can then connect them if the moment is taken care of, but then where do I go from here? For example, NAMI classes, NAMI support groups, other resources, groups in the community, other places where they can go to get ongoing education and support for their situation. It can all start with a call or a text to 988.
Yeah, definitely. All right, I just got our 10-minute warning a couple minutes ago, so I'm going to pull up, I think, one last kind of generalized question that I'll have each of you respond to, and then I think we'll wrap up. So just give me, in general terms, what are we looking at now? 5 to 10 years down the road, what are we preparing for? What are you excited for? And what still needs to be addressed? And whoever wants to just jump in first.
Well, Joe brought up the 5-year, and that's a really valid point, because 911 was established in 1968. Mm-hmm. It took a long time for 911 to, and actually, by the way, in Alabama is where it started. It took a long time for 911 to become established, funded, and used the way. Now we have a TV show named after it, right? But that was not always the case. And that was within the lifetimes of many of us, me for sure, who, me growing up in a small town, we didn't have 911. We called the local police department or the sheriff's office directly with a regular number. So it's important to put that into perspective, and not expect 988 to be fully developed and fully realized, within a few months. I think that we're doing some phenomenal work. I'm just so proud of the response that's happening here in Iowa. But to Joe's point, there's a lot more to it. And my dream would be within 5 years that we're going to see any Iowan who reaches, first of all, that we're going to see a massive shift in an understanding on the part of the public that they can and should call 988 when they're experiencing a behavioral health crisis rather than 911, to take that burden off of primarily law enforcement, and direct it to where it can be immediately addressed. But secondly, that those calls, if the person needs an in-person response, that is met with trained mobile crisis responders. And that could be law enforcement, because Joe and his crew do a phenomenal job of teaching CIT. But most law enforcement in Iowa are not trained at this point. So trained mobile responders, whoever that is. And then if they need a place to go, that they have a place to go, whether that's an access center or some other physical location where they can be transported to and attended to and evaluated and helped. So that's my vision. And I think we can achieve that within 5 years.
Awesome. Anyone else?
Yeah, since it's utopian, 988's fully staffed, but you guys only get one call a month. No, I'm kidding. So what I really genuinely think is, because I love what Peggy just said and agree with it. And also to the point Adrian was making earlier and what Emily was saying is, my concern is always for the provider first, right? Because without them, we can't have effective programs. And when Adrian's talking about an effective crisis response or staff counselor on the phone that is sharing in that burden with someone for a moment, we know that a majority of counselors in Iowa are not master's levels clinicians. And so they don't understand that boundaries sometimes, not all of them, but some of them will absolutely take on some of that burden. And it's to the point where we have this high attrition rate. And so I think we have to really be looking at, to the point that was made earlier about the empathy from a supervisory standpoint of how difficult this is. It's been the same for 911 dispatchers. Oftentimes they have it harder than the first responder because they don't get to see the outcomes. They don't get to see the person. They're only hearing it. And the brain plays tricks on people that don't actually see what's going on. And so having the job of just helping people via text or phone only, and you're getting them at their worst moment, and then you're sharing that burden with them, my fear is that they would personalize that a little much, and then it starts to wear them down to where either A, they're not effective, B, they want to leave. Because again, it would be great if they had those self-care mechanisms in place to where you guys are turning people away from applying because you're so staffed up that, and the referral base of like word of mouth, you have people chomping at the bit. Hey, how do I get in? I want to help be a part of this great thing 988's doing, because it really is a feel good position. I think once it's up and running, fully operational, that's some really impactful, powerful work that would give people a lot of purpose. But if it's not managed well, I worry about the toll it would take on the individual mental health of the provider. And so anyway, I think it's important we continue to talk about that. And then the other side of that is, yes, we are continuing to do a great job on the phone, and we're diffusing and de-escalating and creating safety plans and everything else over the phone, but that they're not then just left there, right? Just because we have a successful intervention on the phone, there's something going on where I would worry then about what happens 24 hours from now, 48 hours from now, 72 hours from now. Is anyone checking on them? And so what does follow-up look like if there's an opportunity for that, maybe to a referral? So just things to look forward to, because again, these are people. And I think a great way to address this is not simply being reactive to the problem, but being proactive, that if someone's calling 988, that's a great opportunity to identify a member in our community, to find out how we can help them going forward, to where maybe they could identify some way or means to utilize the resources in the community, so they're not having to utilize these crisis lines unless it's emergent. So anyway, that's my 2 cents on that. But again, I think the future is bright. And Emily, I appreciate you sharing those numbers. It's awesome that I was already answering 93%. I think that should be applauded regardless of how many that is, whether it's 5 or 5,000, it doesn't matter. 93% is 93%. And so I think that's important to celebrate those successes as this continues to roll out.
Yeah, definitely. Okay, we've got just a minute left. So
Oh, I'm
Adrienne,
sorry.
Emily, you're good. But if you want to just jump in real quick and give us your thoughts, and then we can wrap up.
Yeah, I would just mention that we absolutely, Joe brought up follow-up. We didn't have a chance to talk about that, but all of our contacts that are high risk are absolutely getting follow-up. For me, making sure that there's enough revenue to adequately support 988. Adrienne and I want to pay our people a living wage. We want to make sure that they have all the tools they need to do their job well. And it's an expensive service to provide. My hope for 988 is that it is an entry to a very consistent system across Iowa, that any Iowan, regardless of where you live, regardless of your age and who you are, you can have access to the level of care that you need, that is safe and the least restrictive possible, and have a variety of options in your own community. It is a pipe dream, and I think we can get there, but I think it's going to take some time and effort on behalf of a lot of different people. And I think 988 is just getting started.
Awesome. Thank you. Adrienne.
I don't really have anything unique to add. I feel like our other panelists have really, covered, I think, what we're all hoping for and hoping to see, across the state over the next 5 years with 988. I think we have a really incredible opportunity to transform our crisis services here in Iowa. And so I guess I'm really excited to be part of it and to be able to have an impact on individuals' lives.
Awesome. Thank you so much. Well, thank you so much to our panelists. We're out of time, but thank you for coming, and thank you to our audience members as well for being here, for listening. Just a quick reminder, there are several more Iowa Ideas sessions coming in the next hour on the Human and Social Services track. The next session is about the availability of beds for those in crisis, which we touched on a little bit here. So if you want to learn more about that, stick around, I guess, go find the link for that session. And then I'm also moderating a session this afternoon at 3:15 that will focus on recent suicide trends and how the state is responding to those. So again, if you want to learn a little bit more about mental health resources in Iowa, you can come to those sessions as well. So thanks for being here, everyone. We really appreciate it. And yeah, have a nice day.
Thank you.
Thanks.